Welcome back to our channel, Nonaty World. Today, we will shed light on everything you should know about somatic OCD and its effects. OCD, also known as obsessive-compulsive disorder, is a well-researched mental health illness marked by recurrent, unwanted thoughts or compulsions and repetitive acts or thoughts or obsessions. To relieve the tension that follows these obsessions and compulsions, you perform in ways that you wouldn't typically do. Somatic OCD is one of the various subtypes of OCD that is associated with automatic bodily functioning. A less well-known but no less disturbing type of OCD is called somatic OCD, also referred to as sensorimotor OCD. This subtype, which frequently results in anxiety and distress, is focused on automatic bodily processes and sensations. We'll talk about somatic OCD today, including what it is, how it manifests, how it affects your health, and coping mechanisms and treatment options. What is somatic OCD? One kind of obsessive-compulsive disorder, called somatic OCD, causes hyperawareness and obsession with body functions and feelings. Breathing, swallowing, blinking, and other reflex actions that the majority of us take for granted are examples of these experiences. These automatic bodily sensations become the focal point of an obsession for a person suffering with somatic OCD, which can be upsetting and disruptive. The following traits can be used to differentiate between general obsessive worry and somatic OCD. 1. Having intrusive thoughts about automatic bodily processes and sensations all the time. 2. Hyperawareness to the point of disrupting daily activities regarding particular body sensations. 3. In order to alleviate anxiety resulting from somatic OCD, repeating actions. 4. Keeping away from events and activities that could cause upsetting thoughts. Things to know about somatic OCD symptoms. While somatic OCD symptoms can differ from person to person, some typical symptoms of the disorder include 1. Focusing on and keeping track of certain bodily functions all the time, such counting the number of breaths, blinks, and heartbeats. 2. Being unable to stop or control such upsetting thoughts, which causes significant levels of tension and worry. 3. Trying to manage the focus on somatic experiences and other bodily functions by repeating activities or behaviors. 4. Difficulty focusing on different tasks, which results in low productivity and subpar social and professional performance. 5. Checking one's pulse, counting breaths, and counting swallows as a compulsive way to make sure one's body functioning normally. 6. Deliberately avoiding circumstances or pursuits that could increase awareness of bodily processes. This can involve abstaining from physical activity, socializing, going out to eat, etc. The effects of somatic OCD on mental health. There are several ways that somatic OCD can affect your overall health. Anxiety brought on by a persistent focus on bodily processes and sensations can seriously affect a number of areas of your life. Somatic OCD has been shown to psychologically exacerbate stress and anxiety. Moreover, pessimism and sadness may be exacerbated by the incapacity to manage unwanted thoughts and the discomfort they cause. Feelings of inadequacy and low self-esteem can also result from somatic OCD. Physically, it can be physically taxing to continuously monitor bodily sensations due to the mental strain involved. Your sleep patterns might be disturbed by the stress and anxiety caused by somatic OCD, which can lead to insomnia and poor quality sleep. In terms of somatic OCD's social ramifications, it can make you avoid social situations in an effort to stop your obsessions from being triggered. Solitary living may result from this. Additionally, it could be difficult for you to focus on work and other activities that might impair performance and productivity. Somatic OCD doesn't cause injury or danger, but it can have a significant negative influence on your social, emotional, and physical health. Other mental health conditions, including depression and generalized anxiety disorder, AD, might be brought on by the ongoing stress and anxiety linked to this problem. How is somatic OCD treated? The disorder may respond well to a combination of self-help techniques, medicine, and therapy. Here's a treatment plan for somatic OCD. 1 CBT or cognitive behavioral therapy. CBT is a well-known method of treating OCD. This method focuses on recognizing, questioning, and substituting positive ideas and behaviors with the negative ones linked to OCD. Exposure and response prevention therapy, ERP, which involves progressively exposing yourself to your obsessions without indulging in compulsions, is another cognitive behavioral therapy, CBT method for treating OCD. 2. Medical treatment. In order to manage the anxiety associated with somatic OCD, medications may also be recommended. You can get pharmaceutical prescriptions from a psychiatrist to help manage your OCD symptoms. By raising serotonin levels in the brain, these drugs can elevate mood and lessen anxiety. 3. Attend support groups. Joining a support group might help you develop a feeling of understanding and community. Recovering and healing might be aided by the coping strategies and shared experiences of those who have faced comparable challenges. 4. Techniques centered on mindfulness. Acceptance and commitment therapy, as well as cognitive therapy based on mindfulness, are other methods for treating compulsive thinking. By learning to accept the existence of intrusive ideas without responding to them, these approaches can be beneficial to you. Your daily life may be less affected by them as a result. How can somatic OCD be handled? Among the coping mechanisms for somatic OCD are: 1. Awareness. Being mindful entails focusing on the here and now without passing judgment. You can become conscious of your thoughts and feelings without becoming overcome by them by using this strategy. 2. Employ calming methods. Deep breathing, gradual muscle relaxation, and guided visualization are a few methods that can help lower anxiety and increase calmness. 3. Establish a schedule. One way to lessen the uncertainty and anxiety associated with somatic OCD is to establish a regulated routine. To feel good and be less nervous, make time in your schedule for self-care, social gatherings, and physical activity. 4. Disprove negative ideas. To lessen the influence of your obsessions, develop the ability to recognize and confront bad thoughts. Here, cognitive restructuring can be useful. To manage somatic OCD, you can also attempt to reduce your need for reassurance and develop your ability to endure ambiguity. 5. Get expert assistance. Seeking professional support and help is indicated when you start to feel highly distressed, when you can't function properly, when self-help techniques stop working, when other mental health concerns persist, and when you start to have thoughts of harming yourself. Concluding, a misdiagnosed kind of obsessive-compulsive disorder called somatic OCD causes you to concentrate on your physical experiences. This kind of OCD can affect how you live your daily life and function by raising stress and anxiety levels. You can enhance your well-being and learn to control your symptoms by receiving the appropriate treatment and coping mechanisms. Don't be afraid to get professional assistance if you continue to battle with somatic OCD symptoms. We hope this video helps you understand somatic OCD and how it affects your health. Share your opinions with us in the comment section below. Be careful.